chat. It is staying safe during COVID-19, what our IBD patients need to know about medications and infusions. My name is Alyssa Strauss. I am a patient education manager with the Crohn's and Colitis Foundation, and I have the honor of moderating our discussion this evening. We do have with us two experts today. I'd like to introduce Dr. David Hudesman. He's the medical director of the Inflammatory Bowel Disease Center at NYU Langone and an associate professor at the NYU School of Medicine. He also serves on the Professional Education Committee of the Foundation's National Scientific Advisory Council. And we also have with us Kaitey Morgan from NICA, the National Infusion Center Association. She serves as their Director of Quality and Standards. And prior to joining NICA, Kaitey was an infusion nurse for over 10 years. So thank you both for joining us this evening. We're excited to do this chat. We know many of our patients require scheduled infusions right now, whether they're going to a center or they're receiving their infusions at home. And we've been getting a lot of questions in our help center regarding the new restrictions on social distancing and staying at home. And patients are concerned about how they're going to get their infusions safely and maintain a safe environment for themselves and their loved ones. So we're going to start with Dr. Hudesman. For those patients that are scheduled, let's say this week, next week, this coming month, what is your advice for those patients with regards to keeping his or her infusion appointment?
Thanks, Alyssa. And, first I want to, thank the Crohn's Colitis Foundation for putting together this important program. And these questions are very common and we're getting them multiple questions a day about this. I think just to take a step back, most important thing that we're telling our patients is to stay on their medication, right? Active inflammation, we think, is one of the biggest risks for coronavirus, and staying on your medication, whatever medication that may be, I think is the most important thing. And that goes for infusions. So whether you have an infusion tomorrow, a week from now, or 2 weeks from now, it's important to keep that appointment. Again, you want to keep your disease in remission. And practically speaking, this isn't something that's going to completely go away if you delay it for 1 week or 2 weeks. So, really stay on target, stay on your schedule.
Okay, great. No, that's a good advice to keep. Now, what about for patients, perhaps if their center has closed, or perhaps now there's limited hours and they can't get there and they need to find a new place to go? What are you advising to your patients, and how are those authorizations being handled?
Sure, and I think it depends also where you're getting infused to begin with and what type of center, but a lot of centers are still open, right? Not every center, but a lot of centers are still open. And I think it's having that discussion earlier with your physician, and then they can help guide you. But they're depending on whether, I'm in New York City. So depending whether you're still in New York City, a lot of people have left New York, but it's working with me to see if we can find a local infusion center by where you live. And that a new infusion center would have to do a new authorization process, but that's something my team would be able to help out with, to send all those appropriate records to speed that process up. So I think the key is discussing with your physician early on and helping find a local infusion center wherever you might be, whether if your infusion center where you live closed or temporarily closed, or whether you left a specific area and moved somewhere else with your family at the time.
I would also add to that, if a patient and their provider determine that they need to find a new site of care right now, or for any reason, the National Infusion Center Association has a locator, I think we're at over 4,000 infusion centers, and we have full-time staff that's working to keep that updated, calling and reaching out to these centers, especially in New York City, these really hard-hit areas, to make sure that the listings are up to date and reflective of who's actually open, and accepting outside referrals. And in the locator, you can search, filter by specialty, medication, amenities, parking, Wi-Fi, that kind of thing. So I think, it's just a really great tool always, but especially helpful right now. We've seen a real uptick in the use of it.
And that's being updated for the current situation right now.
Yes, and that's locator.infusioncenter.org.
Okay, great to know. So Kaitey, with regards to the infusion centers that are open and serving our patients right now. Obviously, patients have a lot of concerns about safety and protection. So can you share with us a little bit how infusion centers are currently protecting patients as well as staff? And is this standard across the country as far as safety measures?
Sure. So I think it's important, first of all, to remember that infusion centers are experienced in taking care of patients with altered immune systems. It's what we do. So, infection control and prevention are always top of mind, even outside of a pandemic. And, in the current situation, centers are stepping up those efforts. So increasing the frequency that they're wiping down high touch surfaces, countertops, keyboards, doorknobs, that sort of thing. And then, of course, all the equipment and supplies that are used for patient care. So the chair, the blood pressure cuff, all of that. Centers are also screening patients and staff and visitors, if they're still allowing visitors. A lot are not. But they're screening them for symptoms and exposure, usually the day before the appointment, because that's not the kind of thing you want to find out last minute. But then often they're also screening upon arrival, sometimes even before they'll let them in the building, repeating those same questions, checking temperatures, that sort of thing. A lot of infusion centers are requiring everyone, patients, staff, to wear masks. And, that's a newer recommendation, as we know, that's come out sort of recently, relatively recently, because we know you can spread COVID-19 before you have symptoms, or some people never develop symptoms at all. And then other interventions are being put in place to maintain safe distance within the center. So some sites are only using private rooms. Some don't have private rooms, so they're seating patients in every other chair, keeping an empty chair as like a buffer. Waiting rooms can be problematic. So, centers are either removing chairs or just not using waiting rooms and having patients wait in their car, and they'll call when they're ready for them. And that way they can just escort them in right back to their chair. They don't have to wait around. Maybe doing that registration process once they're back in the chair. And staggering appointment times is another thing we've seen and recommended to just reduce the volume, the number of people in the room. Those are sort of the primary strategies, I would say.
Okay, great. And then as far as when a patient leaves their appointment, it may sound silly, but is there anything they can do to protect themselves once they're heading home, whether it's getting in the car or taking public transportation? Is there any recommendations?
So, the biggest thing is wash your hands, always. Hand hygiene is really our best defense against spreading anything, but, colds, flus, COVID-19. So, wash your hands with soap and water. If there's a sink, if not, hand sanitizer works. Be really mindful about not setting your keys, your cell phone on surfaces like maybe the checkout counter or the table in a waiting room, and then putting those keys, phone, whatever, back in your purse or your pocket, because you've now taken all those germs and put them on everything else in your purse or pocket. So even if you get home and disinfect your phone and keys, it's a little bit too late for that. So, if you can limit the number of things you're bringing in with you and putting down, and if not, then, disinfect them before you put them back in your bag or your pocket. And the other thing, before you even leave the house, I think, is take a minute to learn the right way to take off a mask. Only touching the ear loops, dropping it in a bag, and then laundering it when you get home before you wear it again if it's a washable one. Because, it's sort of too bad to wear that mask and then touch it with your hands and get those germs all over yourself and everything else you touch.
And just to add, we get a lot of questions, especially people in New York City being nervous to go anywhere, right? Especially whether it's to an infusion center, whether you get an infusion in an office setting, whether you get it in a hospital setting, not physically in the hospital, but in a hospital setting. And what I'm always stressing to my patients is right now is probably one of the safest times to come, in the sense that nobody's around, right? So the streets are pretty empty. We infuse in my office, and we're doing, close to 100% of our visits, outside of a few here and there, are virtual, We also have colonoscopies in that area and other procedures, and pretty much we're not doing any of them right now. So the only people that are coming in are for infusions. And as we just heard, sort of all these protocols are, being put into place. And since we actually have more room now, we're spreading people out more, keeping the distance, and sort of doing whatever we can, right? We can't make that risk zero, but everything's being put into place to really minimize that risk. So I always feel more comfortable having them come to us where we're one of these infusion centers with these types of protocols where we know, they're following certain standards.
Right.
Yes, and that actually goes sort of into my next question. So I think there are some patients who are wondering if, they might be safer to have a home infusion. Some people may only have the option of home infusions. And so what are your thoughts, Dr. Hudesman, regarding home infusions and if patients are considering switching to that option?
Sure. So I think, first off, again, most important thing is to stay on medication. I think, above and beyond, that's the most important thing. Personally, and this varies, I'm preferring my patients go into some type of infusion center, right? And meaning whether it's sort of my center, whether it's another center, but it's important to discuss with them what type of standards and quality measures they're putting into place, because not every center or every office does it the exact same way. And the reason is not that the home infusion services aren't cleaning and wearing gloves and taking all those protocols. There's just more factors we can't control for. Whether maybe one of my patients, they're the fifth patient getting a nurse is coming into their home. Those other 4 homes, right? Are they following strict social distancing? Did they just have somebody else come in, whether it's a nanny or cleaning the house or a friend or a family member? So there's just more things that I can't control. So preferably, I'm actually telling people to go to infusion centers. If there are some patients on the flip side have asked, look, I'm getting home infusion, I'm a little bit nervous of having somebody come in, and I'm sort of saying for 1 time or 2 times, come to the office, and we've been getting insurance approval for that.
Mm-hmm.
I also have a handful of patients that sort of left New York. We're having a hard time changing insurances with the office, with the local center, and that's when we're doing the home infusions. And we're just discussing with them what questions to ask and making sure that those home infusion services are taking all precautions.
Right. So that goes into my next question. So let's say you are having home infusions, right? So what can you expect from the nurse when he or she arrives at your house? So should they be coming in like scrubs and a mask, or should they be coming in and then changing into the scrubs and the mask? I mean, it sounds ridiculous, but as a patient, you want to know what's the safest approach.
Right. So, I mean, they should be coming in with a mask, with gloves, right? All that equipment should have been wiped down before they've come in. And I sort of recommend making sure the patients are telling them to do that again in front of them, right?
Mm-hmm.
Sort of another time. I'm also asking the patient if they are used to getting home infusions, depending now it's New York, so not all apartments are very big, but picking in an area that's a little bit sort of separated that you had cleaned and then could clean afterwards. And I think that's what I'm telling them to look out for. I'm not, I don't think all these home infusion services are changing clothes every time. And I don't necessarily think that's, needed, but I think sort of having you taking it upon yourself to have an area, cleaning that area before, watching them clean everything themselves, mask and gloves.
Okay, great. So Kaitey, a question for you regarding COVID-19. And let's say you're a patient and you have the virus, you're at home and you're resting, but you have an infusion schedule coming up. What are you recommending, or what would you recommend for these patients?
Yeah, so so many of the medications that are given in infusion centers change the way the immune system works. It's why we give them. And a lot of times we're going to hold an infusion for any illness, right? So whether it's, flu or UTI or something, and COVID-19 is no exception. We need to give the body the best chance to fight that infection, whatever it is they're dealing with. So if a patient, is tested and is positive and has an infusion coming up, they really need to call their provider, the one that orders their infusions, usually their specialist, and let them know what's going on. So together they can come up with a plan that's safest for that patient, and then also, everyone in the infusion center, the staff. But really it just comes down to communicating with the provider and making sure that it's the best plan for the patient. As much as we don't want to hold treatment, right? We don't want diseases to flare and send these patients right into the care settings we're trying to avoid. We also have to be smart about it.
right? And I think that's a great point. And I think, we don't have great data on this, right, just yet, right? Do you hold infusion? How long do you hold? And if, practically speaking, if we hold it, are we really making a huge difference? Because a lot of times the medications are still in the system. But it's practical to say if you have a new active infection that you're going to hold that infection, whether it's 1 week, whether it's 2 weeks. And a lot of factors come into play, the severity of the COVID and also the severity of the underlying disease. What I do think is important, though, is speak with your physician to discuss sort of what are the protocols, because just an example at NYU, the cancer center's protocol, where if you're positive, now you could be asymptomatic now, but to be able to be allowed back in, if you're positive, is different than, let's say, what we're doing at our infusion center, right? And that might vary from one place to the other, right? Do you need repeat testing? Is there a certain amount of time when symptoms resolve? So I think it's important to know that, where even if you have it, you're saying, look, we're going to hold it for a week, for 2 weeks, for 3 weeks, whatever it may be.
Oh no, we lost Dr. Hudesman. We lost him. Okay, we're going to hope he joins back quickly. But I think the advice we're getting is to talk to your doctor and come up with the best plan. And I think that goes along the lines of, what if you were exposed? So let's say you don't have the infection, but you're living with someone perhaps who was exposed, or you know you were exposed. And I know you said, Kaitey, that they screen, you do a screening beforehand. But what if Dr. Hudesman, you're back. So what if you were exposed, right? So what if you're not positive, but you were in contact with someone, or maybe someone in your household has it? What are we talking about when we advise patients then?
Right. So, there's a lot of, exposures, or, and especially if you're working a large office and somebody on the floor has it or somebody at home has it. So I think first thing is you want to self-quarantine, but I am not telling my patients to hold an infusion if they had an exposure, right? Unless they're symptomatic. And again, I think it just goes back to the fact that keeping on medication, staying in remission is the most important thing. I think what we're doing is we're just following up with those patients a little bit more, as we heard earlier, whether we be checking symptoms a day before, a couple days before, but I think we're just following up with those patients more frequently before that infusion. But unless there's symptoms, I'm not holding just because they've had an exposure, because I've had, many patients that have had these exposures and they didn't develop COVID symptoms, and I had other ones that have. So for me, they really need to have those symptoms for me to hold that infusion.
Mm-hmm. Yeah, I think that's pretty similar to what we've been hearing, especially, you're in New York City. I think everyone probably has been exposed to someone who's positive, right? It's pretty common. That's the most common advice I think we've been hearing. It's definitely provider specific. So, we always want to tell patients to, again, get in touch with their provider and talk through the best plan for them. But most often it's, self-isolate, monitor for symptoms, and then the treatment decision, is a separate discussion.
Right. And just one more thing to add is that I look at known COVID and suspected COVID or presumed COVID as the same thing. So especially, different areas for testing, the availability of testing significantly varies. But in New York, for example, for a while now, although we're starting to have some more outpatient tests, there was a few weeks where there was just such limited outpatient tests. And I had patients calling with low-grade fevers, and you don't need to have a true fever over 100.4, right? With a cough or loss of sense of smell or taste. Anything somewhat sounds like it, I'm presuming they have it. And the discussion we've been having, I've been treating them the same way. So whether they test positive or whether I have a discussion with them and I think they're presumed positive, if they have symptoms, I'm going to hold, right? In most cases, if they were exposed but they don't have symptoms, right, I'm gonna, still allow them to get infused. So I sort of lump in right now known COVID and presumed COVID, because we just don't have enough testing, and also some of the testing just isn't accurate.
Mm-hmm.
Okay, now that's super helpful. So what if the infusion center calls you the day before, like Kaitey was saying, and they say, have you been exposed to COVID? And you're like, well, I'm not sure. I might have been, so could the infusion center deny you, even if your doctor is telling you to go? I mean, do you know, can the infusion center say, we're advising you not come?
think that's where the communication is key, right? Because, the infusion center, those are important questions to ask, and they might want to, err on the side of caution and be like, look, why not? If you were exposed, why not wait? But I think everybody just needs to talk. And so that's why sort of having that discussion earlier if possible, not the day before, right? Or if the patient calls and says, hey, the infusion center sort of asked me this question and now I'm not sure, then just let the physician know immediately so I could call the infusion center and say, hey, this is okay. But it also, again, it depends on the center, what their policies are. So early communication is the best.
Great advice. I do have one final question, and Dr. Hudesman, I know you're a GI for adults, but for pediatric patients who are in need of infusions, is there any specific guidance that you would give to parents or caregivers of our younger patients, perhaps different than adults getting infusions?
Yeah, I think it's a great point, and I don't want to minimize, right, obviously this pandemic at all, but again, most important thing, whether you're an adult or a kid, is to get your medication. What, we've been seeing so far is really the risk, this risk of severe complication in that pediatric population, right, is very, very small. So that concern about, oh my God, if they have it, the risk of severe complications are so small in that population. So just another reason where it's important, right, to really stay on your medication, especially if they have active disease, they're in their growth phase, they're still very young. So I think staying on medication is key, and doing the same. I think the one thing, though, to discuss, though, is, for example, in the adult infusion center, we're not having anybody come and wait, right? So they can't have a guest with them in the center. If somebody drives them in, we tell them to wait downstairs in the car, and we'll communicate for them to, come down. With the pediatrics, you are allowed, a family member there, but how many, who that could be, I think that varies as well. So I think that's an important discussion to have. But for adults right now, we're not having any guests with them or visitors with them.
And I'm not a pediatric infusion expert by any means. I do have kids, one of whom is very concerned about what he's been seeing and hearing about the pandemic. So I would say, it's important to help prepare the little ones ahead of time with what might be different, because, all these protocols we've talked about being different in infusion centers, it might look different. So, as the parent or caregiver, it would be a good idea to call ahead and find out, like Dr. Hudesman said, what is the change in visitation policies? Also, what might look different? Is the furniture going to be different? There are fewer chairs and they're spread apart. Their favorite nurse is going to, look like an astronaut with the hat and mask and gown and the whole thing. So, that's scary anyway, but if you can prepare them ahead of time for that and just let them know, it's to keep them safe, and also remind them of the things that are staying the same, right? They're still getting the same medication, that keeps their body healthy. It's their same favorite nurse they know and love, even if she looks different or he looks different. I think just a little bit of preparation ahead of time can go a long way.
No, that's super helpful. Thank you. Thank you both so much. We really, really appreciate Dr. David Hudesman and Kaitey Morgan from NACA. Thank you. I know some of you may have some additional questions, and we encourage you to contact our help center. You can give us a call. It's 1-888-694-8872, extension 8. You can also email us. Our email address is info@crohnscolitisfoundation.org. We also do have a live chat with a specialist that's available Mondays, Tuesdays, and Thursdays between 9 a.m. and 5 p.m. Eastern time. So feel free to take advantage of that. We are experiencing a lot of questions about COVID-19, and we do have a section of our website. It's right at the top of our homepage where you could see some COVID-19 resources. We are updating those pages very regularly, almost on a daily basis, as information is constantly changing. So we do encourage you to check back regularly. We will be having some new and updated information on medications specifically. So I encourage you to check that out over the next few days. I know some of you have asked this is going to be recorded. So tomorrow morning, or at some point tomorrow, we will have this recording available on our website. So we encourage you to share it with others that you know who may have questions about infusions, or a loved one or someone you know with IBD. So we want to continue serving our community with programs like this, as well as other education and support programs that are needed really now more than ever. It's a challenging time for all nonprofits, not just the Crohn's and Colitis Foundation. So we are struggling, to raise the funds we need. So if you can, we hope you'll consider perhaps making a contribution today to support programs like this and other critical mission activities at the foundation. So again, thank you, Dr. Hudesman. Thank you, Kaitey. Thank you all for joining us today. Everyone stay healthy and safe and have a good evening.
Thank you.
Thank you.
All right. Bye, everyone.